Hi, my name is Tim Ria, host of Digital Health Live here at CES 2015. We are in the WebMD studio in the back of the conference room. We've got about 800 people on the other side and having a fantastic event. We got James Mault with Qualcomm. How are you doing?
Great. Good afternoon.
Yeah, good to see you again.
Good to see you too.
And
Boy, it's been a busy conference.
Too much singing.
I heard him on the karaoke floor last night. So, and then we got Adam Pellegrini with Walgreens.
Mm-hmm. Hi.
So, tell everybody about your background. You're an entrepreneur, doctor, then you're heading things up in some really interesting areas at Qualcomm.
Yeah, I've been at this in fact, we were reminiscing about 15 years ago. I was at CES exhibiting a digital health solution on the Palm Pilot. And here we are now 15 years later, and I think it's finally coming to fruition. I'm the Chief Medical Officer of Qualcomm Life. After a company that I started, Healthy Circles, was acquired last year. And Qualcomm Life has made a lot of progress in helping mobilize healthcare. It sounds like a cliche, but it's really all about being able to enable the medical grade device industry and have a seamless experience, frictionless connectivity in the home for those devices to get into the hands of what could be a Walgreens pharmacist who's managing and monitoring your health condition.
That's really interesting is how Walgreens is on every corner in every major and minor city in the United States. But first of all, Adam, what is your background?
So I've been in healthcare most of my life. Started out as a combat medic in the Army, worked as a surgeon's assistant and aviation medic, and then transitioned over into digital. Worked with Jim at Microsoft Health. So both of us worked on Health Vault and all the other fun stuff. Yep, back in the day.
Out in Redmond?
Out in Redmond, beautiful Redmond. And evolved and started focusing on work around the American Cancer Society and the digital health initiatives there. And then doing a startup called Healthy Circles with Dr. Mault here out of Microsoft. So lots of digital health, and interestingly watching the industry evolve to things that we wouldn't have dreamed of 5, 6, 7 years ago.
Like, I remember the Palm Pilot and all that was happening and coming out, and that was pretty innovative back then. And today I've got the Samsung Note 4 that plugs into a virtual reality headset and transports you to inside a video game or doing an Ebola camp. It's crazy. So what was the topic of the panel?
So we were talking about, really now with Adam as the VP of eHealth at Walgreens, the announcement we made earlier this week, the strategic partnership between Qualcomm Life and what we're doing with our TueNet device connectivity system and our Healthy Circles care coordination system, and bringing that together with Walgreens on the digital health side, and the great things that Adam has been doing with the Balance Rewards programs and literally, to our insight, leading the world's foremost device connectivity digital solution. I mean, Walgreens now can easily claim to have the world's largest population of device uploads to my knowledge in the history of modern medicine, and so it's a really exciting place to be. This panel was all about how medical and retail are coming together, and that makes total sense now. The technology has evolved to make this simple and magical, and then you have the retail with all of their vast experience on consumer engagement, and then the pharmacist. I mean, most of health conditions are in many ways all about taking your medications, and so Walgreens has a core competence, the trusted pharmacist in your neighborhood, and so we're really excited about how these two things come together.
I want to get my mind wrapped around of how big Walgreens is.
So a little over 75% of America lives within 3 to 5 miles of a Walgreens. That's how large the footprint is of the organization. Walgreens recently became even bigger and is now a global pharmacy working with our Boots Alliance partners in the UK. So really, how big is the Walgreens, Boots Alliance company? It's the largest global pharmacy, I believe, in the world. But what's really important is the consumer engagement numbers that we have. 82 million active members of our Balance Reward, just our loyalty program alone. Probably more like 110 million in total, are all coming into our stores, going online, using our phone. We do 1.6 prescription refills via the Walgreens mobile app every second.
Say that again.
1.6 prescription refills via the Walgreens mobile app every second.
I'll brag for them. And again, this has been pretty remarkable in all the 15 years that I've been in this space. Walgreens literally has the most prolific digital health app in existence.
I want that, but I wasn't out of Walgreens, but I'm going to switch.
There you go.
And so what's fun is Walgreens pharmacists. I don't know if you'll be able to zoom in on this. So this is an app that will literally, now this device is being retailed by Walgreens, and it will,
It's a Walgreens activity tracker wearable.
Okay, so you guys
by Stride.
Okay, cool.
but this goes further than that because now, so I don't know if you can zoom in on this. This just suddenly said, did you take, just went away on me.
So it's a survey tool built into the wearable as well. So now you can ask questions via surveys around people and have that feedback into a coordination system. So it's extending the wearable into more use cases. And with Qualcomm, we not only now can do the wellness wearables and the fitness wearables, but we can now create these clinical use cases that protect HIPAA and privacy and those things and separate the two together from a data perspective.
So this is literally saying, did you take your medication today, and be able to actually respond back, yes, and then this goes back into the cloud. So we're talking about bidirectional monitoring into a new scalable, cost, affordable price point. I mean, this
It's almost
changing because historically, to do this interactive health monitoring, you're talking about a device system that costs $100 per patient per month, and so then you could only afford to give that to a very few really sick patients. But now what this does, and these price points and this convenience and simplicity in the hands of a mass market retail pharmacy is makes digital health and patient monitoring, medication management a mass market option for healthcare systems.
So this is available today, or it's starting to roll. The announcement's today, but then this is all rolling out.
Right. So today we have connected devices on the fitness and wellness side, but bringing in the Qualcomm infrastructure and the 2net capability, that's something that we'll be rolling out in the next 6 to 12 months, as well as the use cases that Jim was just talking about today of how do you extend wearables into something that goes into medication adherence, for example. If you can imagine, the next generation of med adherence could be a wearable buzzing on your wrist when you get close to a Walgreens, reminding you, hey, you got a refill ready to pick up. Those are all capabilities through our APIs that this wearable will be able to leverage. So imagine it becomes your wingman, if you will, for medication adherence.
Cool. That's pretty intense stuff.
Oh, that's great.
So it's almost like just turning the light switch on as this all rolls out, and it's a whole new paradigm.
Yeah, and then you start adding to that. Here at CES, the explosion in and experimentation, frankly, of new types of sensors and measurements that just weren't possible 10 years ago. And then with the connectivity and an API model, allow these different measurements and different sensors to be able to come together and start, having the medications and your temperature and your activity and your sleep. And then we can start going, wow, if we knew that all together in one place, we have some insights that we never had before.
I feel like we're coming out of the Stone Age. Literally.
Absolutely, absolutely. And I think what we're seeing is logical use cases that consumers see as convenience. And if we motivate them with rewards and add that to convenience, then we're going to see the adoption.
With one other caveat, and that is there's going to be, anytime in this kind of era of rapid technology evolution and experimentation, there's going to be a fair amount of snake oil, and it's going to be very important for organizations like ourselves. CES has been instrumental in creating the Health and Fitness Division Board, which Adam and I both are members of that board. It's very important that there's responsible behaviors on the part of industry to be transparent about what these devices are actually doing, what they're not really doing, because there's going to be a lot of spin, and you'll see skepticism on the part of the medical community, and that's a good thing, because you want somebody to add a reasonable doubt to some potentially wild claims. But if we do this legitimately, responsibly, transparently, with good science and outcomes, and then show the patient the benefit and reward them and incentivize them, make it fun, this is going to be a really, really happy place for all of us.
And I can ride my bike there.
Or your hoverboard.
Yeah, or my hoverboard. It's just coming.
Someday. Happy and healthy. There you go.
All right, cool. So, guys, what's next for the rollout and things like that? We're going to wrap this up, so we've got one more opportunity.
I think you'll see as we start exploring remote monitoring and use cases around hospital readmission reduction, which we're already doing with our Well Transitions product, you'll start seeing new use cases around the connected devices that can really engage the patients in the next 6 to 12 months.
It sounds like we have now the garden, the infrastructure, the fertilizer, and now we're just waiting for creativity and explosion and
sprinkling a little water on it here and there. Another example is we have a mutual relationship with MD Live and remote physician consults. Walgreens made their announcement a few weeks ago. Qualcomm has had MD Live as an employee.
Hi, Randy.
Hi, Randy. And so enabling those types of broader sets of capabilities, remote patient monitoring.
So we have MD Live as a mutual intersection. WebMD, we made an announcement about our relationship with WebMD this week, which, all of us working together, it's very exciting, because truly the only way digital health is going to evolve is through partnerships and synergies where all the partners see the value of each other, and the sum of the whole is greater than the parts.
And they're all here. Everybody's here, and you guys are using this as a launch ramp to reach the world's media and press for this. So how do people connect up with you guys if they want to partner or learn more?
They can actually email me, adam.pellegrini, not Pellegrino, at walgreens.com.
Okay.
Our website is qualcommlife.com, and we have lots of ways of accessing the teams and information, but
your glasses rock.
And I want to thank the teams out here who are bringing all the innovation, Jill Gilbert, for setting us up, and it's really cool and fascinating to meet the actual press of flesh of the guys and gals and people knocking it out of the park. So cool. Congratulations.
Thank you so much. This is really great.
Thanks again. All right.